All right, hello, and thank you for attending our virtual session today. My name is Alexia Rebney. I'm the admissions coordinator for the Master of Science Occupational Therapy program at UW-Madison. I'm delighted to share this session with you today. I myself am an occupational therapist and I adore my job, and I'm very excited to tell you more about why the future of OT is so bright and why UW-Madison is a great choice to begin your studies in occupational therapy. So again, U.S. News & World Report has ranked occupational therapy as a highly valued job in 2016, a hot job in 2016 by Business Insider, and the future growth of the profession is expected to be 27% between 2014 and 2024. So it's a great career to be researching right now and looking into, and a great program to be applying to at this time. So here at Wisconsin, our occupational therapy department is within the School of Education, Department of Kinesiology. And within our Kines department, we have our Master of Science Occupational Therapy program that trains individuals to become occupational therapists. We also have our Doctor of Occupational Therapy program available to those who previously completed a master's degree in occupational therapy or a bachelor's degree in occupational therapy, but also completed a master's in a different field. And so those individuals are in clinical practice and they're ready to advance their skills in leadership and move the profession forward. So we now have the online doctorate available. We also have a PhD in occupational science available to those who would like to complete a research doctorate here at UW-Madison. Our faculty are renowned and they are wonderful to learn from. I myself completed our MSOT program here in 2007, and I couldn't say more about how wonderful these instructors are, and they are also researchers in the field making great gains for our profession. So first I'm going to tell you about Dr. Ruth Benedict. She is our program director, and this summer she was presenting in Sweden at the International Conference on Cerebral Palsy and Other Childhood Onset Disabilities. Much of her research is focused around cerebral palsy and also access to services for children with special needs. A lot of her research has an epidemiological focus. Dr. Dorothy Edwards is the current director of the Collaborative Center for Health Equity here on the UW-Madison campus. She is also a fellow of the American Occupational Therapy Academy of Research. Much of her studies have examined the impact of stroke and Alzheimer's disease on cognition and complex life activities, especially in African American populations. You can look more at the information about our faculty and the grants that they are currently holding on our current webpage about the faculty research pages. So be sure to visit that webpage to read more about the different grants and studies that our faculty are currently involved within. Dr. Elizabeth Larson is also an instructor who has really been someone who impacted me as a student. Much of her research is focused on the aspect of caregiving for individuals who have a child with disability or a family member with special needs. She also looks a lot at cultural differences in caregiving. Due to the impact she has had on OTs in the profession, she was added to the roster of fellows via AOTA in 2014. She is also greatly involved in the Mixed Methods International Research Association. So much of her research, again, is impacting our practice for future time to come. She was also this summer, took a trip down to Guatemala where she brought some equipment that was donated by some facilities in the Madison area. The equipment was brought there based on a needs assessment that our occupational therapy students did last year, looking at what equipment would impact the lives of these children at this orphanage to make their meal times more independent, make the aspect of caregiving and the level of independence that these children have at the orphanage to increase those levels. And so if you'd like to read more about that visit that Dr. Larson had this summer, please feel free to again visit our OT program Facebook page. Dr. Carla Osterau is a leading researcher in mealtime routines for families who have children with autism. Her research lab takes place here on the UW-Madison campus within the Weissman Center. And the Wasteman Center is a facility that is dedicated to the advancement of knowledge and about human development, developmental disabilities, and neurodegenerative disorders and diseases. So she is there, her lab is there, actively doing research to impact these children's lives and the family routines, also meal times in the community. A lot of her research also focuses around children transitioning from using a feeding tube to traditional meal times. She is also involved with the school-age parent program in Madison, and our OT students, this is an area where they can actually complete some research looking at different interventions that are going to allow the students participating in this program to have a successful completion of their high school education. Dr. Brittany Travers currently has some really fantastic research taking place. She was featured in our OT Matters newsletter, which is also available on our website if you'd like to read the newsletter in full. She actually looks at brain imaging and brain changes after interventions for children and young adults experiencing autism. So please be sure to, again, check out that entire newsletter if you're interested on our webpage. Dr. Kristen Pickett was recently featured by the Parkinson's Disease Foundation for her depth of research that has been actively used in the field for individuals with Parkinson's disease. And she currently has a tango class available on campus for individuals with Parkinson's. Our students contribute to that class. Prospective students can participate in that as volunteers. She also has in her research lab a kitchen that is able to examine a task, and on the floor it measures how many steps an individual goes through while completing a task. And so it can really give an objective measure of completing a functional activity after going through the tango class. Or she also has a project with the art department looking at glass blowing interventions for individuals with Parkinson's disease and how that increases their overall capacity and ability to participate in life events. So again, really neat things taking place here on campus, and all of these individuals that I'm mentioning are instructors in the program, and students are also allowed to have them as mentors for their research project. Our academic staff also contribute to the program in many ways. These individuals have expertise in different areas that they bring to the classes that they teach. Debbie Bebo recently completed her doctorate in education, and she is our instructor for our interventions courses for adults and older adults. She is also the fieldwork educator for our students. Sharon Gartland is the director of our online post-professional doctorate program. Jean Patz has a variety of research looking at children with cerebral palsy again and interventions with OT. She also teaches our OT 100 course, which is available for students here on the UW-Madison campus. I myself work as an OT with older adults, so I've been able to contribute to the program in different ways in addition to being the admissions coordinator. We also have a variety of individuals who contribute to our program based on the different areas that they've excelled in practice, whether that may be owning their own therapy company or starting a school program for children with autism. These individuals help contribute to our courses to make that experience more rich for our students. So some distinguishing features about our program here at Wisconsin: we have a very rich history beginning in 1943. In 2005, our program transitions to the MSOT, and now in 2016, we added our post-professional doctorate program. We are currently ranked in the top 10% of OT programs in the country, and that's based on the U.S. News and World Report. UW-Madison has an outstanding value of education for the cost that individuals pay to be here, and we were recently ranked 8th out of over 100 public colleges in the U.S. for that. So it's a great place to live and learn, to know that for the tuition you're paying, the value of education you're receiving is so great. Our faculty, as I was mentioning all of those fantastic research studies that they're completing, they are able to do that via grants that they are receiving. And so with over $8 million in research grants, our faculty can conduct the studies that they are interested in doing to impact the future of our profession and impact those lives that we are desperately wanting to impact as OTs. But they also then may have funding available to allow our graduate students to become project assistants or research assistants while working with them, and that could include tuition remission for an MSOT student. So that's something to think about and consider when looking at which program you'd like to attend. We also have very strong partnerships with the clinical community. We have over 100 fieldwork sites that students can complete their internships at. Our OT students recently began a community connections program where we're going to have different lectures come in each week from OTs who are practicing in an array of practice settings, working with diverse populations, working with those veterans, working with those who are experiencing homelessness. So we're trying to, our students are trying to bring in more OTs who work in kind of diverse practice areas to just kind of even get a better understanding of how we as OTs can meet the needs of those in our society. In addition to our clinical community, UW-Madison campus is just a fantastic place to live and learn. We have our Health Science Learning Center, which is kind of the library and center where all of our research articles are held for our students. There's a multicultural student center available on campus for all of our students. We have our Office of Equity and Diversity that's very dedicated to the student experience for all of our students. We have over 800 student organizations here on campus, as I'm mentioning different ways that students can become involved, and those are available to graduate students as well as our undergraduate student population. We have an interprofessional health council that recently began, and that's a group of health science students, so students in different health professions from medical school, pharmacy, nursing, social work, OT, PT. So all these different students coming together for this interprofessional council to participate in lecture series, activities, service, different ways to learn about each other's role in healthcare so we as OTs can function as part of that healthcare team. The campus itself is absolutely gorgeous. Bucky Badger, I love him so much. It is just a fantastic place to be, a beautiful campus, wonderful for walking, biking. Situated between two lakes, we have the water activities, the canoeing, the boating. There's a picnic point, little area on campus, arboretum, a free zoo right near campus. Just a lot of ways to find a place to be and relax and enjoy the Madison community. As I was mentioning, different interprofessional opportunities for our students. This was just posted on our Facebook page recently. Our students participated in a falls event in Dane County. Dane County is the county where Madison is located. But they completed this program with the DPT students and the pharmacy students and the nursing students looking at falls assessments for these individuals who came to the event. So again, neat ways to live and learn together. At Madison, as I'm mentioning, our OT students, we have a very small class size. We have a class size of 25. The photo featured here is our graduating class of 2016. The program begins in June every year, and the students finish 2.5 years later. So they complete 2 years of academic work and 6 months of field work or internships. So they will actually finish in December. Even though they walk for graduation in May, all of our students who are in this photo are now out on their level 2 fieldworks, and hopefully they will all successfully finish their fieldwork in December, and then they can sit to take the board's exam to practice occupational therapy. And we currently have, for the past 5 years, a 100% pass rate for our students who are sitting for that board's exam for occupational therapy practice. So now I'm going to share a little bit more information about the curriculum and what kind of courses that the students complete while they are enrolled in the program. We have our foundational knowledge courses. Our human anatomy course actually takes place in that first summer. It's a full cadaver dissection. It includes a lecture, a daily lecture, and 3 days a week of 3 hours of lab where our students in small groups go through the cadaver dissection. We also have our neuroanatomy course taught by Dr. Kristen Pickett, the individual I mentioned who has a lot of research focused around individuals with Parkinson's disease. And so she teaches that course. That's taken with the physical therapy students, as is Anatomy 622. We also have our medical conditions course where the students learn from experts. We have our UW-Madison campus situated right within UW Hospital. So physicians from that hospital provide lectures for our OT students about different medical conditions that our students are going to encounter when working with patients receiving occupational therapy. So there is a physician who provides a lecture about a total hip replacement, a physician who discusses physiologically what's happening in the body with someone who has multiple sclerosis or somebody who has autism. So that really gives the students a nice understanding of a condition, so then the students can begin to think, how is this condition going to impact someone's life? We also have our base knowledge courses, our theory courses, so that students can become really good problem solvers. And a lot of our program courses have some group work involved, again, part of that team approach. We also have our critical reasoning and clinical decision-making courses. And within these courses, the students learn how to provide that intervention. Currently, our program has sort of a developmental model across the curriculum. In the first summer semester is gross anatomy. That's kind of, the human body covered more so in adult, but we also have a discussion section in that summer where the students get to learn about palpation anatomy, and they start to look at measuring range of motion. It's a nice way to kind of apply what they are learning in the cadaver dissection to patients that they'll see out in the field or clients that they'll work with in the field. And then in that fall semester, the students have a course where they learn about interventions in the spring semester. That fall semester is more theory-based. In the spring semester, the classes are focused on children and young adults. Within that semester, the students complete a 40-hour level 1 fieldwork. And then in the fall semester, when they come back, the courses have a focus on adolescents and young adults. And then in that final spring, the students learn about interventions with older adults. And in each of those semesters, again, a 40-hour clinical is included. And then students leave for 6 months of clinicals, 2 different settings, wherever they'd like to be across the country. Again, our Facebook page, great place to see what the students are up to. This was just last week, where our students were working with clients who had experienced spinal cord injury and a variety of conditions, and this was in one of their interventions labs. So right now, this fall, where they're learning about adolescents and young adults and conditions that might happen within those age ranges. And so again, in lab, we try to have a lot of hands-on experience for our students, where we have past clients. This is Debbie Bebo's class, so past clients are coming in, allowing students to work with them to begin their learning before going to fieldwork, before going to level 1, and then before going to level 2, just to even build on all those skills before students are getting out into practice. We also have our courses where students learn about different techniques that are going to allow them to be successful outside of just providing the intervention. So we're looking at documentation. The students actually learn about grant writing. They write a grant within the program. Whether or not they want to submit that grant is up to them. They learn about community-based interventions, independent practice. And so these courses, again, allowing students to be successful outside of just providing the intervention, cultural sensitivity and care, different topics that, again, are going to allow them to be very strong OTs in the future. We also have our scientific inquiry track. So this is a really unique component of our program at Wisconsin. So in addition to all of that fantastic clinical preparation, our 100% pass rate on the boards exam, each student will have the opportunity, they must complete a research project, a mentored research project with one of our faculty members. And as their capstone, they all present their research posters at an event here on campus. We also have our students often presenting at the American Occupational Therapy Association conference. And so that, again, is an opportunity for students to have a mentorship from a faculty member completing true and active research where they are answering a question of their own. And we've actually had posters published of our students, so it's all, true, and it makes it very applied. So the classes where the students are learning about different data analysis and systematic review, those different research areas, evidence-based practice, how to use evidence in practice, they're also applying that to a real-life situation. And so that's a really neat way for our students to gain an understanding and appreciation for research in the future of OT. So this is all sounding really fantastic. A lot of this information, again, is available on our webpage. Also, again, continue to monitor our Facebook page for neat things happening on campus. And of course, then you can find our admission criteria available on our webpage. So we require a bachelor's degree is completed by the time the program begins in June. So it's absolutely fine if undergraduate students are graduating in May and beginning a few weeks later. We have a lot of students applying right now who are in that situation. It's also fine to take time off between finishing a bachelor's degree and coming back for a master's. We require a 3.0 GPA on the last 60 semester credits of the bachelor's degree. So that includes roughly the last 2 years of the bachelor's degree, and coursework completed beyond the bachelor's degree does not contribute to that. This is a requirement of our graduate school. If an applicant does wish to apply to Wisconsin, but they do have a GPA, a last 60 credit GPA, that's slightly below the 3.0, there's still a chance they could be offered admission if the admissions committee feels that they show good abilities to be successful in graduate school. They have strong grades on recent coursework. They have strong GRE scores. So it's certainly fine to apply if you do have a last 60 credit GPA below 3.0. But right now that is available, but the 3.0 requirement is what we post as on our webpage, and you'll see that the median score for students offered admission is quite higher than 3.0. Our GRE is also required, as are 3 letters of recommendation. You can submit up to 5, but if you're going to submit up to 5, just make sure you're really making good decisions. We'd like to see really 3 strong when we review an application. We require a personal statement. We have an experiential requirement. We want applicants to spend time in at least 2 different settings with populations who might receive OT services. This can include, and we highly recommend that it includes, some observation of OTs or certified occupational therapy assistants in practice. We also require some prerequisite courses. Further information about the prerequisites, that information is available on our website. So if you visit our prerequisite coursework page, you can kind of look at different options for courses in the Madison area or online. Any of these courses can be completed online. If you take a human physiology course that's combined with human anatomy, like Anatomy and Physiology 1 and Anatomy and Physiology 2, as long as those courses included a lab that satisfies the physiology with lab prerequisite and the anatomy with lab prerequisite. Just here at Wisconsin, the anatomy lecture and lab courses are split, so that's why we kind of list our prerequisites in this way. I often receive questions about the lifespan development prerequisite as well. Here at Wisconsin, we have a series of courses that focus on child development, and then course options that focus on adolescent and older adult development. So we require 1 course focused on young adults, 1 course focused on older adults, or you can complete 1 course such as developmental psychology or a 3-credit course titled lifespan development that kind of focused on the entire lifespan, but then also complete an additional course that focuses on any specific area: child development, infant development, child psychology, adult development, aging. So we want to see up to 6 credits of developmental coursework. Steps for applying are available on our website. We do require the OT-CAS application. If you have specific questions about completing the OT-CAS application, I'm going to encourage you to look at the instructions and frequently asked questions available on the OT-CAS website. You can also email OT-CAS with questions. That's probably the best way to move forward with your OT-CAS application. We also require the UW-Madison graduate school application. We ask that you send your GRE scores to UW-Madison. Our code is 1846. Your GRE scores will then automatically be paired with your graduate school application. Within that, being that you've already completed letters of recommendation via OT-CAS, we don't need you to send letters of recommendation again. And then the system actually requires for some of the areas that there is a specific uploaded document. So we created a placeholder that you can use that basically states, please see my OT-CAS application for this application component. So you can upload that into various areas of the graduate school application so you don't have to send duplicate materials. There is a section in the UW-Madison graduate school application where students can, if they would like, write a statement about why they specifically would like to attend the MSOT program at UW-Madison or why they would be a good fit for the program. And so if you do wish to do that, it's completely optional, but you can upload that via the personal statement section of the UW-Madison graduate school application. Again, instructions are available on our website. So when the admissions committee is reviewing an application, these are the different characteristics or the personal qualities that we assess, that we rate each applicant on. So these are the different qualities that you really want to give strong evidence of when preparing and completing your application. We're looking for an applicant who displays strong communication and interpersonal skills, insight to occupational therapy, strong leadership skills, life experience, maturity and responsibility, and a strong depth and breadth of pre-OT experience. So you're going to want to think about spending time with populations across the lifespan in a variety of settings, whether that's observing, whether that's volunteering, whether that's a paid position you might have. You want to try to get experience with individuals who have a variety of medical conditions, who have a variety of economic and cultural backgrounds. You want to show in your application that you have strong communication skills when writing your personal statement, when asking those who are writing letters of recommendation for you. You might want to ask them if they could please comment on these skills, as these are the different characteristics that the committee is especially interested in. When writing that statement of purpose, considering what makes you unique as an applicant, thinking about the things you've done, and how these different activities give evidence of why you would be a successful occupational therapist. You want to be very specific and descriptive. Vague statements, you know, I did this, that's great. We're going to actually see that, though, via your experiences section. So use that statement of purpose section to really give us a window into who you are as an individual and why you would be a unique candidate. For our small class size of 25, we want to enroll a group of students who are going to learn from one another, who are going to, you know, develop each other's skills in addition to what they will bring to the program. So really identifying, you know, why you would be a great OT and a great addition to the profession. Within that, we'll be able to see, you know, that you understand what OTs do in practice, what skills, you know, are evident of a strong OT. So those are all different aspects that the committee is looking for when reading your personal statement. Again, thinking about those letters of recommendation, someone who can really comment about your communication skills, you know, especially with those who have conditions that OTs might see in practice, with family members who have children with special needs, or family members who are caring for, you know, someone in their family who has needs at the time. Those can be really great letters to show that, yes, you're comfortable, yes, this field is right for you, yes, you have the skills to be a strong OT. It can be also very nice to see an academic reference. So really try to include an academic reference, someone who can comment about why you would be a strong candidate for graduate school here at Wisconsin. So again, I was mentioning kind of some things to think about when preparing your application and applicants who are offered admission. So 60% of our decision is based on academics, 40% is based on non-academics. So these are the median scores for students offered admission this past cycle. These are posted on our website as well. And we previously were looking at specifically how many hours did individuals spend observing an occupational therapist. So I mentioned our experiential requirement, where we want you to spend time in at least 2 different settings with individuals who might receive OT, and then those students who are also observing. We used to have a strict 40-hour requirement. So this past cycle, the hours of observation that students spent that's strictly observing an OT ranged from 40 hours to 584 hours. Those are for our applicants who are offered admission, and on an average median of 4 different settings. So when you're thinking about that observational experience, to kind of be thinking about where you want to spend time with OTs. It'll be interesting to see now when we're reviewing this year what we're seeing for number of hours of strict OT observation. 58% of the candidates who were offered admission here at Wisconsin also had research experience as an undergraduate. And so that could be volunteering in a research lab, that could be working in a research lab, gaining some experience that's going to make you a strong candidate for graduate school. That could make you a strong candidate for a research assistant position if you're interested in trying to obtain some funding as a graduate student. So kind of thinking about trying to have some research experience in undergrad can be a really nice way to add strength to your application. So just to kind of give an idea of who is in that class of 25, these are some statistics for students who were offered admission this past summer. So we have, age range from age 22 to 30. Again, about half of the students are coming directly from undergrad, and about half of them have taken a year or more off in between. 18 of those students are Wisconsin residents, and we typically offer admission to a relatively equal number of in-state and out-of-state students, sometimes even more out-of-state students. It's typically, though, that students from Wisconsin, being that we are such a strong program in our state, will choose to attend. 13 of those who are enrolled in the program completed a bachelor's degree at UW-Madison. We do not have a specific, any sort of preference for Wisconsin, but a lot of our students here on campus, with all of these opportunities I mentioned that are available for graduate students, a lot of those opportunities are available for undergraduate students. So we typically see a lot of strong candidates from Wisconsin, but we see a lot of strong candidates from schools across the country. So please don't feel that that number should deter you in any way. Again, we're looking for strong students from big schools, small colleges, liberal arts schools. Wherever you are, we're excited to see your application. Common undergraduate majors. So we don't actually require a specific major. We enroll students who have a variety of majors, and that's part of what makes that class of 25 a neat group of students to be a part of. So we have students enrolled in the program admitted this summer who had majors in community health and Spanish, linguistics, geography, journalism, special education. And then we commonly see psychology, rehabilitation psychology, kinesiology, human development, and family studies. So those are just some majors to be thinking about if you're exploring. But again, we're looking for individuals who have any major who have shown a strong dedication to a future in OT. In our second year class, we have a student who was a pharmacy student, now who's becoming an OT. So again, that's really up to whatever your interests are, follow those and build on those. And those are going to enrich your experience in undergraduate and graduate school, and you will be able to apply those experiences as an OT. So again, in our second year class, these are the statistics. When the students began, they were 22 to 29, so kind of similar. And so again, the common majors are listed here as well. So if you're interested in thinking more about OT in general, I was mentioning, how the future is so bright. AOTA has so many wonderful resources for prospective students. You can look at frequently asked questions about education and career planning, hear stories about OTs who work in different practice areas. Those resources can really help you build on your understanding of what OTs do, where do they work, how do they intervene with clients. So again, really nice resources. On campus here at Wisconsin, we have an OT 100 course available on campus for our Wisconsin students, which is a 1-credit Intro to OT class. We also have a pre-OT student organization on campus for those considering OT as undergraduates. Again, the Facebook page, great place to see about what's happening within the program. Dane County has so many volunteer opportunities for students so thinking about county resources, thinking about what opportunities might be available via campus resources to really get involved with populations who might receive OT services. So again, my name is Alexia Rebney. I'm happy to help answer your questions. We do have some time for a few questions today. I'm going to pull up my email here, and so if I'm able to answer a few questions before I need to end the session, I absolutely will. If I can't get to all of them, I will certainly answer them via email. So just if you'll send me an email, otadmissions@education.wisc.edu. I'd be happy to try and answer a few questions right now. If we can, just make the subject advising session question or something of that nature. And we'll see what we can get through here. Our kinesiology graduate program coordinator is also an individual who is extremely helpful, especially when you are in the process of completing the UW-Madison graduate school application. If you're experiencing any difficulties with submission or how to submit components or how to use that placeholder I mentioned, please feel free to contact our graduate program coordinator. And if you find yourself at AOTA this coming year, please don't hesitate to stop by our Wisconsin booth. We love to have a really nice beanbag toss going and having a good time there and helping individuals learn more about the opportunities available at UW-Madison. So thank you so much. This is one of our beautiful campus spots, Bascom Hill. Oh, dear to my heart. Bucky Badger and Abe just look so wonderful together, and it's just a beautiful place to be a student, a really supportive environment. And again, I hope you really consider applying to and then hopefully attending UW-Madison. So with that, I'm going to pull up my email here and see if we have any questions that have come in. Question about GRE scores. Are specific scores needed? And that answer is no. We do not have GRE minimums. So again, the median percentile scores for students offered admission kind of give an idea of where scores are, but we do not have specific scores that need to be achieved on the GRE. Again, a question about the GPA last 60 credit 3.0 requirement. Again, you are welcome to apply. The admissions committee, if we feel that we would like to offer you admission and we would like the graduate school to offer admission, the graduate school pretty primarily goes on the recommendation of the admissions committee. We will tell the graduate school why we feel that you would be successful. Again, that's prerequisite coursework, that's strong GRE scores. And we have not had a student in the past who has had a GPA below 3.0, who the admissions committee has felt would be a strong candidate, not be offered admission. So those students have been enrolled in the program. We just had a question about international students, and so our UW-Madison Graduate School has on their webpage and information about the requirements for international students. It would be very similar though, completing the OT-CAS application and completing the UW-Madison Graduate School application. The TOEFL is also required if an individual did not complete a bachelor's degree program where the primary language was English. So checking those requirements on the UW-Madison Graduate School application page is going to be the first step. And then if you have specific questions, please feel free to email me if you have further questions about transcripts, things like that. Thank you. I just had a question about the character limit for the personal statement. That 7,500 characters is a guide. Actually, when you upload the personal statement in OT-CAS, there is a file size limit, but you're not going to be disqualified or that we will not read your application if the personal statement is beyond 7,500 characters, but that is a guide. That is what the committee likes to see. We like to see about 2 pages. So really being direct and concise about why OT is right for you is the best path to take with that personal statement. This question is about any opportunities for undergraduates on campus here. Our faculty do offer undergraduates opportunities to volunteer in their research labs. So looking at our website and reading about the different experiences of the faculty members, looking at what their current active studies are, and then possibly sending a message to them identifying that you'd really like an opportunity to volunteer within their lab. And hopefully, if there is a position available, that our instructor would be able to offer that. Again, though, those positions are going to primarily, meet the needs of our OT students enrolled or our PhD students. But we have many undergraduate students who have volunteered with our OT faculty and research. I also encourage students to look across campus. So when I mentioned, 58% of our applicants had research experience, that's experience in a variety of labs. From limnology labs to labs in our UW hospital looking at different conditions. Human development and family studies has a lot of really fantastic research on campus. Our educational psychology department has some really great research taking place. We are a level 1 research institution here at Wisconsin, so many of our campus departments have really fantastic opportunities for undergraduate students. We have an undergraduate research scholars program here at Wisconsin, a lot of really nice mentoring opportunities. So hopefully that's something you can look into at the university you attend as well as a possible experience to have. Job placement, question about job placement here. Very good for ROT students. I do not know a single student who has not been able to find a job. Specific statistics on that would be through our department from those that have been able to send back information. We send out a survey to our graduates. Where are they working? Are they enjoying their jobs? And so I have not heard of a single student who wasn't able to find a job. The market for OT in general is so great, and being prepared in a nationally recognized program is a great thing to be thinking about when wanting to secure a job as an OT in the future. Thank you for that question, though. How many applicants do we typically see? For the last 2 years, we've had 350 roughly applications, and that is 350 complete. So making sure that every one of those applications has the OT CAS app and the graduate school application, and then all of those have the admissions criteria met. Our deadline to apply this year is November 16th, if you'd like to begin in June. Okay, so I think I'm going to take the opportunity here to wrap up, but I really appreciate those of you who have been able to attend today. It's been a pleasure to communicate with you. This session is also being recorded, so if you would like a copy of that, please send me an email. I'd be happy to provide it to you. I hope you strongly consider UW-Madison and continue to contact me with questions. Have a great weekend. Thank you.